Hi, it's Amanda with Beyond Birth Doula, here to do a little video about hand expressing. So if you're wondering what is hand expressing, it's using your hands to express breast milk. You don't always need to have a pump. That's something that I think in our society is just, hey, you're pregnant, what pump are you going to register for? Some women actually have a better output with hand expressing than they do with the pump. So I like to make sure that my clients, whether they're local or whether they're far away, which is why I'm doing this video, that they're given the support and the guidance on how to hand express correctly, because you never know when you may use it. You may find yourself without the baby, without the pump, and feeling like you're a little full and in pain and needing just a little bit of expression to help relieve that pain. So I always want to remind my clients that it should never be painful. Hand expressing or pumping should never be painful, and neither should latching your baby, but that's a whole other thing. If you're having pain in any of those areas, please give me a call and I will help you out. Should never be painful with hand expressing. Hand expressing, I've used it in the past when my baby wasn't around, and I just hand expressed into a burp cloth because I just needed a few, like 30 minutes before I got home to feed. So once again, sometimes women have a better output with hand expressing over pumping. So, you know, even if you plan to pump at work, you can always try hand expressing to see how that goes for you. With hand expressing, you can catch it in a cup or a bottle. I've seen women catch it in a jar. I always just kind of used a burp cloth because I really wasn't trying to have a full feeding or get a full amount. I was just trying to get some relief. So first things first, when you go to hand express, make sure you have clean hands. As moms, we're always like, everyone wash your hands, and then I forget that I need to wash mine. So hand expressing, you are touching your baby's milk. You're touching your baby's food, so just make sure you have nice clean hands. I will not be showing my anatomy. I have a plush crocheted boob that I received as a gift. Yes, I get gifts of boobs, which is amazing. It's my favorite item to be able to use when talking with moms on how to latch babies and also hand expressing or pumping. So with this, you see that it does have a nipple, and then this part on the outside is the areola. So when you go to hand express, what you're going to do is keep your hands on the outside of your areola, either U-shape, C-shape, you know, whichever hands you're comfortable with, but you're going to push back and then roll forward. Push back, roll forward. There's no tugging, there's no squeezing. You don't want to clamp off those glands so that they don't release the milk. You're just trying to massage. This is a great way to think about it. Massage to get it out. So you want to work your way all the way around the breast. See if you feel any of those lumps with the ducts that are full. You know, kind of massage it nice and relaxed. Big thing is to stay relaxed. Even with pumping and breastfeeding your baby, if you're tense, your body is going to tense up and milk is not going to come out. We need to be in a relaxed state. So I'm always encouraging clients that even when they're pumping to not necessarily massage your breast, but just relax, take a breath, even at work, especially at work. Take a moment and just breathe. If you have a video of your baby or a picture of your baby, look at that, a scent, a memory, something to kind of bring you into like a happy little zone, and it helps just get that milk flowing. Please do not just stare at your breast as you're pumping or hand expressing, because that just tenses you up. You're just kind of waiting for it to happen. Relax is a big part of this. So as you're going, one thing that's going to happen is a letdown. So everyone asks me, what's the letdown? What part of the whole milk expressing is the letdown? So the letdown is once your milk appears. So whether it's squirting out, whether it's dripping out, that's when you have a letdown. Some women feel a letdown and some women don't. And that's perfectly normal. And if you do feel a letdown in the early days, and then all of a sudden a month or so later you're realizing you don't feel yourself having a letdown, that's also very normal. So having that feeling or not doesn't matter. So once the milk starts to come, that's your letdown. Now, it's not going to happen right away. Please don't sit there and squeeze and squeeze and squeeze and, you know, really get worked up about it. The baby, when a baby's eating, or if you're using a pump, you know it has that first little initial like suck, 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 suck. And then when the milk has a letdown, it's more of a suck, suck, swallow for the baby, or the suck, suck, swoosh for the pump. So it works the same way with hand expressing. You kind of need to give it a little bit to come to get down there and start to flow, and then it'll be much better at the flow that it does. So it does take some time before you get that good like spray type flow, even with hand expressing. So that's about it when it comes to hand expressing. When you're all done and you go about your day, I will be doing a video about pumping here soon to also include, because I think there's lots of questions about, you know, what flanges to use and things like that. But hand expressing is a wonderful tool to have, whether you plan to use it or not. So if you have any questions, please let me know. Thanks for watching.